here in North Carolina. Just to catch people up a little bit, across the country, things are kind of stable. Some states, a few smaller states, have continued to have slowly declining numbers. About 20 states or so have numbers that are slowly increasing. The Midwest is still an area which is struggling a bit, particularly the upper Midwest. And those states have predominantly been states that do not have mask mandates, and personal distancing is not as strong in their state guidance for their citizens. Here in the Southeast, things are pretty stable. Here in North Carolina, over the last 2 weeks, we really haven't had any increase in cases, which is good news, but we really haven't had any declining cases per day, which is bad news. So I guess we can take it as stable. I would have liked to have seen when the curve flattened out, that it would have flattened out at a little bit of a lower level than what it has. But having said that, I think most places are doing okay in the state right now. Here in Forsyth County, our numbers continue to inch down slowly. They're not coming down quite as fast as they were a week ago. 20 to 30 new cases per week. Predominantly, these cases are in younger people between the ages of 18 and 25. That's the highest proportion now, which is reflected nationwide as well. The proportion in elderly people has gone down considerably since the beginning of the pandemic, which is good because, as we've talked about forever, is that older people have more trouble with COVID and deaths. Our universities in the area are doing okay. Elon, Davidson, Wake Forest. A little bit of a hiccup last weekend between Campbell and App State, for those of you who follow football, because of some cases in athletics. That game was postponed, as well as the Notre Dame Wake Forest game, but that was postponed because of cases in the athletics on the Notre Dame side, not the Wake Forest side. So athletics continues to be a little bit harder. Contact sports means you're having contact, which means cases get transmitted. And when it gets into a football team, for instance, it can spread kind of rapidly. And so this has been issues with college football, and as of this week, even with NFL football, as we've seen, 2 teams that have had to postpone games because of cases. And then the one team that was playing, the other, who had cases, ended up having to quarantine some players. So we're having some football, but there's hiccups and bumps along the way. That's true also with high school football. So people may not necessarily high school football. Let's say high school athletics. People may not say, well, what the heck, most of our high schools are all virtual and aren't having games. But actually our private schools have been undergoing athletics. For the most part, non-contact sports, but cross-country, tennis, volleyball, things like this, where the sport themselves really isn't a problem for transmission because it's mostly distanced. I mean, what could be better than cross-country running if you have a staggered start? But there have been some kids who've had to quarantine in some of the private schools in the area because they ended up being within a 6-foot distance for more than 15 minutes, and for a lot of this, it's been on the school bus on the way to the event. So maybe some lessons learned out of there. Maybe parents can be driving instead of using buses. But so there have been some quarantined kids. There have been no transmissions that I know of in the wider Triad area of COVID involving schools that have been going on, and none actually with the athletic event itself. It's just been people who acquired COVID outside of the school or in the family, or in some other social event, and then they became positive but had contact with some kids at school, and so they have to quarantine. It's what's supposed to happen. If you're in contact, you quarantine. Doesn't mean you're going to get it. So no known transmissions in schools that I know of yet here in our wider area. In fact, nationwide, very, very small numbers of schools actually involved in the transmission itself. So, but 99% of the time, when you have a contact investigation involving the school, it's a case that was acquired outside the school, and then through the contact investigation, quarantine happens. So, one very tragic case that's made the national news, also in the area, involving a student who's from the Triad area originally, in college, who acquired COVID and died of a rare complication. And while we talk about how young people do much better with COVID, every now and then there are hospitalizations. Every now and then there's an admission to an ICU, and very, very rarely there's a death. It's really hard when young people die of rare complications of infections that are fairly common. Historically, this is something our society has dealt with over the decades. Measles, whooping cough, for example, other childhood diseases, polio in the 50s. And all of these events are extremely tragic. Many of these we've gotten out of through vaccination, and this is why we have our widespread childhood vaccination programs. I mean, you hardly ever hear a child dying of whooping cough anymore. So with COVID, fingers crossed, vaccine on the way. And in the next few months. The other thing I'd like to talk about is a study out of India this week, and you might say, out of India, how does that affect us? Well, it basically reaffirmed a lot of things we've seen from other areas. 20% of people with COVID transmit this to 80% of people. So it means that small numbers of people infect large numbers of people, which means if you look at that transmission cycle, it's one case has an effect on a lot of people in transmitting it to them and actually giving them COVID. A lot of these are super spreader events. And why do I bring this up now is because we're entering phase 3, which, I mean, really is kind of more phase 2.78, but since there still are some restrictions. But the more opportunities you have to come in contact with other people who might have COVID, the greater the chance of one of these 20 to 80% events and being in contact with the super spreader events. So while I think that phase 3, as put out by our governor with some restrictions, overall is okay, but I think people still need to think about that and be aware. So what's involved in phase 2.78, actually phase 3, is opening up of amusement parks, which for the most part I'm not sure we're going to see a lot of, because I think a lot of the major ones have kind of folded for the season anyway. There may be some events at some of these, but there would be at reduced capacity, and then it would be outdoor events only. The other thing that's opened up is movie theaters at 30% capacity. Whether a movie theater is going to decide that that's enough for them to warrant opening, we'll have to see. But maybe we'll have a chance to see a movie as we go into the holiday season. And then I think lastly, the big one is bars. And bars can open at 30% capacity if it's outside, And then if it's inside, for every 1,000 square feet that they have, 7 people. So what's 1,000 square feet is roughly a 30 by 30 foot area with 7 people in it. Not a lot of people inside. In fact, if everyone's watching a football game, you can probably hear everyone cheer individually. But the bars, though, is one area that we have a fair amount of information now where transmission occurs. And because it's inside, they tend to be less well ventilated. People tend to be close. No one's masking because you're drinking or eating, right? So this is an area. So, you know, I caution people who might want to go and have a cocktail or a beer the following. One is sit outside. It's a lot better. It's beautiful right now. Two is stake it out. If it looks like there's more people in there than there should be, or that you can't personally distance, it's probably not worth it. Third, try to keep your mask on when you're not actually drinking. Put the mask up, take a sip, put the mask down. Because I think this is an area particularly where that we could run into some issues. The other thing is I just told you that here in Forsyth County, the proportion of people who get COVID is highest now in the ages of 18 to 25. This is also a group that goes to bars. So young people, bars, intersecting. This is an area we may run into trouble. If you're a college student and you're a stakeholder in completing your semester, because you're about halfway through now, you don't want to be in quarantine for 2 weeks for having been exposed in a bar setting. So let's talk a little bit about influenza and flu and COVID. So lots been talked about here. The two together sound bad, and the two together would be bad if both of them were severe and circulating at the same time. You can get flu at the same time as COVID. We know that from last spring in doing virologic studies in individuals who had gotten sick with respiratory illness, and then we do look specifically for viruses. In the San Francisco outbreak that occurred in October, roughly about 12% of people had flu at the same time as COVID, and both were circulating fairly strongly in San Francisco there, so it can happen. Are people, when that happens, actually sicker? We don't really know 100% for sure, because most of the people where that happened to recovered. Flu is potentially, somewhat treatable with Tamiflu or Relenza, but I think that a person who might be more susceptible to more severe effects, who would have gotten both, is going to have a higher risk of having severe disease, ICU admission, or maybe death. So the two together is not going to be a good thing. Does that mean it's going to happen? Well, all of the measures that we take to reduce the chance of getting flu also reduce the chance of getting, all the measures we take to reduce the chance of getting COVID also reduce the chances of getting flu. So personal distancing and masking. They're both respiratory viruses. They're both predominantly transmitted by droplets. There's a little bit of a glimmer of hope there that maybe this year's flu season won't be as bad. And in fact, in the southern hemisphere, flu's is a winter thing. So in the southern hemisphere, winter just is getting over, right? So we know that flu wasn't as bad for most of the southern hemisphere countries this year. So, but personal distancing and masking has to be done in order for us to get this benefit. So it means it's not the time to start letting down our guard. So even though you might hear phase 3, oh, it's gone, right? We're in phase 3. No, there's still COVID around. So personal distancing and masking is still important. Hand hygiene is still important. Hand hygiene, which is hand sanitizer or washing your hands frequently, reduces the chance of getting COVID. It also reduces the chance of getting flu. So wash in, wash out. Get in the car, hand sanitize. Get out of the car, hand sanitize. Go into the grocery store, hand sanitize going in. Come out of the grocery store, hand sanitize coming out, so on and so forth. You get the pattern. So these things will also reduce flu. There is one thing you can do to reduce the chances of getting flu that we can't do yet to reduce the chances of getting COVID, and that's getting a vaccination. We have flu vaccine. Flu vaccine's out. October 1 is the official start of flu season. This is when we really want to hammer into people. Time to get your flu shot. So Forsyth County's Public Health Department is starting today a drive-through flu clinic that's in the parking lot adjacent to the health department. And you can go to their website and you can get a reservation. So if you have a reservation, the drive-through line will be shorter than if you are just showing up. It's like having a fast pass at Disney World. So get on the website, get your reservation, and get your flu shot. And of course you can get it from your primary care provider, you can get it from pharmacies, throughout the Wake Forest Baptist Health System they're available now, and I know they're available at Novant System too. So time to get your flu shot. Who should get a flu shot? That's easy. Anyone over the age of 6 months. Anyone over the age of 6 months should get a flu shot, and this year is an important one to get it. Why? Because, one, you don't want to get flu at the same time you get COVID. Two, no one wants to get flu anyway. Three, if you get sick with flu, it's a little bit hard to know whether you actually have flu or COVID, and you're going to need to get tested. And it's important because it tells you how long you have to stay in isolation. Because if you have COVID, you're in isolation for 10 days. If you have flu, you're in isolation until your fever's gone. So you're out of isolation quicker. Are there ways to know by symptoms whether you have flu or COVID or a cold? There are. We have a chart. In fact, you can get a lot of charts on the web, but we have one here, which will be up on our website probably by the end of the week here, where you can look to see the differences between cold, flu, and influenza. So COVID and flu both have fevers. COVID and flu both have headaches. COVID and flu both have muscle aches. COVID and flu both have cough. COVID is more likely to have shortness of breath than flu. COVID is more likely to have a sense of loss of taste or smell than flu. In fact, that hardly ever happens with flu. With COVID, it's kind of common. You just completely lose the ability to taste stuff or smell stuff. That's more likely to make it COVID. The diarrhea happens about 20 to 30% of the time with COVID. With flu, it's very unusual. So there are a few differences in symptoms. But the bottom line is you really don't know 100% without getting tested. And there are more point-of-care tests being available now, particularly an antigen test, which actually can be done in the office. And this is starting to penetrate our area here a little bit in our primary care clinics. So if you get a fever, muscle aches, cough, and headache, which are all flu-like symptoms, get a test. And then that way you know how long to isolate. The other thing is that that's different between flu and COVID. Flu hits you really fairly quickly for most people. So you'll say, wow, I started watching The Bachelorette and I felt pretty good. By the time the show was over, I felt horrible. So maybe it's not The Bachelorette, but whatever. So you can kind of pinpoint when you got sick. With COVID, it kind of comes over 24 hours. Now, how do these differ from colds? Well, colds are a lot more minor illness in a way. Fever is unusual, Headache can happen, but it's not prominent. Muscle aches, it can happen, but not prominent. It's more stuffy nose, runny nose, sore throat, and then it progresses sometimes into cough. And that's more likely to be a cold. Every now and then you can get a loss of sense of smell and taste, but it's because of your nose being plugged up that it's gotten that way. So those are colds. Colds don't technically need to be isolated. Stay home as much as you can, and wear your mask if you have to go out. I mean, who wants to go out when you're sick anyway? Plus, it's just good manners to not be outside and around people when you're ill. So flu can be treated, right? So we have drugs for flu, roughly 3 of them out there now. We particularly are interested in treating people who have underlying diseases and who are older who have flu, because treatment can reduce hospitalization and complications in that group. So again, it's worth having a test to know. I'm waiting for the day that we have a treatment like Tamiflu for COVID, but not yet. But the trials are ongoing, and it does seem that in the trials that those drugs do reduce the severity and duration of symptoms somewhat if you take it. So anyway, any questions about the flu or colds? Flu's not really circulating yet heavily in the U.S. I really haven't seen much of an indication other than a case pop up just here and there in our area. So, but it's it's early yet. So, mask, distance. Question.
So I've gotten some questions from some Facebook viewers.
Sure, shoot.
I'd like to ask you one of them. In terms of the different tests for COVID, is there one that is more accurate than the other?
So as far as the different tests for COVID, is there one that's more accurate than the other? It's a good question. The answer is yes. PCR tests are a bit more accurate. The antigen test is probably good enough in most situations, though. So if, what I tell our doctors, if you're getting admitted to a hospital, better to have a PCR test. If you're trying to sort out more unusual symptoms, better to have a PCR test. If you get an antigen test, but if you're a doctor and you say, boy, that person really seems like they have COVID, then you back it up with a PCR test. So if the antigen's negative, you send a PCR after that. So it's kind of like with strep throat for kids. Hey, Johnny's got a sore throat. I had a little bit of a fever this morning. I was like, doc looks in there, it looks kind of red, and a little bit of exudate. So, swab it out, rapid strep test, it's negative. We're going to back this up with a culture because that's a little bit more sensitive. Same concept. Any other questions?
I got one more from a Facebook viewer, if I can.
Shoot.
We always talk about the best time to get your flu shot. A lot of folks say right now, a lot of folks say possibly in the next couple of weeks. Is there a right time to get your flu shot? Because it's typically good, if I remember correct, for about 6 months. Is that?
Yeah, so when's the best time to get your flu shot? Last year the flu shot didn't work as well towards the end of the epidemic of flu, and the reason for that is because the virus changed a little bit. It's not because the flu shot dropped off. So right now is a good time. I usually, personally, when do I get my flu shot? I got it yesterday. So I wait, end of September, early October. But I think October is a great time to get your flu shot. Should you wait to the end of the month? Should we get it now? As soon as you got a time to go get it and you got some free time to do it, that's the time to do it. Otherwise, sometimes it's like, gosh, I'm really busy this week. I'll put it off to next week. Next week's just as busy. I'll put it off after that. And then you end up not getting it until maybe it's too late. So let's get it this month.
I find it interesting. Do you foresee maybe a yearly COVID vaccine, like you need a yearly flu vaccine.
Yeah, so do I foresee a yearly COVID vaccine? Well, I don't know yet. It's possible. It all depends on how long lasting the immunity of a COVID shot is. We have the flu shot we have to get every year because the flu virus changes some every year. So we have to adjust the shot, at least right now. Maybe in the future we'll have a universal flu vaccine, but right now we have to do it every year. There are some shots that we get once or twice in our life. Measles, for instance, 2 shots as a kid and you're done. But there are other shots that we have to get boosted every now and then. Good example, tetanus shot and a whooping cough shot for adults. And then we need to get the pneumonia shot sometimes boosted if you're an older adult. So each vaccine's a little bit different. With COVID, it would not surprise me if we have to get it every now and then. Just how often, I don't know. Whether you could go 5 years without a repeat, we'll have to see. Good question. All right, we'll hang it up for the first week of October. So we'll see you next week.